tell our listeners what really kind of innovation you're instrumental in right now in changing the impact on the environment on our bodies.
When we look at toxins, and there's many toxins, there's plastics, there's microplastics, there's toxic metals like lead, mercury, there's what we call forever plastics and forever chemicals where they stay in the body forever. Until recently, we have not been able to get rid of those. Let's take one, BPA. BPA is an endocrine disruptor for both men and women, meaning that it changes where it binds in the body. So for women, BPA binds to estrogen receptor sites and increases the risk of 18 different diseases, one of which, of course, is breast cancer. We quit measuring BPAs 5 years ago because we did not have a good way of getting rid of them.
Welcome to Prescribed by Dr. Nathan Goodyear, where integrative oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now.
Dr. Goodyear here. Welcome back to another Prescribed by Dr. Nathan Goodyear podcast. Got a real treat for you today. And, a lot of people ask me, Dr. Goodyear, how did you get into this integrative movement? Hard to believe I just turned 55. And I've been practicing integrative medicine for about 20 years. Well, this lady sitting next to me, when I first got into private practice, I started to discover, Pam, and we'll get into your bio in just a second, that a lot of what we were taught helped some people, but I wanted to be a doctor to help all people. And so that's what started me down the road of functional medicine, which I think was kind of the key words being used at that time. I use more integrative now because I love what it means. It means to remake, renew, make whole. So I love that kind of backstory on words. But the first lecture I ever went to at an A4M event, it's like at 8 a.m., I think it was Boca Raton, it was you. And you were talking, if I remember correctly, I think it was vitamin D. And so this lady here, Pamela Smith, Dr. Pamela Smith, I'll get into her bio in just a second, has been instrumental because I went back time and time and time again. And you just laid out the evidence. You laid out the clinical practice and application of the evidence. And so now I have an opportunity to bring you in, a physician, I think a master educator. I think you're a great person, okay? You specialize in personalized and precision application of hormone and medicine and wellness. You're diving into cancer. You're, of course, a medical doctor. You have a Master of Public Health, Master of Science in Metabolic and Nutritional Medicine. Now, your background was not in functional medicine. You were 2 decades, right, in ER medicine.
I actually was an ER doc at Detroit Receiving, which is a level 1 trauma center in Detroit.
Wow.
So it was very interesting transition.
Busy. But then, and we'll get into that in just a second. So then you transitioned to, I'll say just a little bit of time in functional medicine, a couple decades there too. And you've expanded beyond that, co-director of personalized medicine certification program at Morsani College of Medicine, University of South Florida. You actually were one of the founders in the Fellowship in Anti-Aging Regenerative Functional Medicine, which I was a part of. And it really was the stepping stone for so many people. It was a stepping stone for me. But you're a published author, and you've really done a lot of work to, I think, empower patients. There's 3 words that I say: innovate, elevate, empower. You wrote a book, What You Must Know About Women's Hormones, and I think second edition was out in 2022. Maximize Your Male Hormones, 2023. Love that. And How to Prevent Breast Cancer Before and After, new book, 2025. Before and After, a guide to taking back control of your life. Dr. Pam Smith, welcome to the podcast.
Thank you very much. Very glad to be here.
You know, it's, I feel like I'm a little bit kind of back in school because I feel like I'm sitting down speaking with my mentor and my teacher. And it's actually, I get a little verklempt, so a little Saturday Night Live humor there. But I wanted to start off a little bit here with the dedication to this book, because I think it says a lot about you and what you do. This book is dedicated to Rebecca Duchesne, who fought the good fight against breast cancer, has now gone on to be with the Lord in heaven. She was one of the most gracious and kind people in the world. Everyone who knew her saw the Lord shining through her. May she rest in peace. That says a lot about Rebecca Duchesne. That says a lot about you. So could you just tell me a little bit about how she touched you and how that led to the writing of this book? I didn't mean for this to be emotional. I'm sorry, but I love stories. I love stories, and when patients touch our lives, I think we have to tell others about it.
Oh, I do too, and patients really, I think sometimes people don't realize that patients touch the practitioners' lives intensely. All of them do, in many different ways. Sometimes it's to help them, go through the whole entire journey, as I did with Rebecca. Sometimes it's just to be the stepping stone, the first thing, and the patient doesn't always hear the practitioner. You're just step number one, and they may need to hear something like weight loss from 5 different practitioners before they decide to go down that journey. But with Rebecca, really, we started looking at many things, and she did fight the good fight for a long time. But being a Christian, it was more of a celebration when she passed away.
And I'd love to say that every patient we see, we win. Sometimes winning is redefined. If somebody has 6 months to live and they live 6 years, high quality of life, that's a win. We want no evidence of disease for the rest of their life. And until we achieve that, that's why we keep working. That's why we're here at a conference like this in Scottsdale, Arizona. And by the way, the setup here, whenever you're recording on the road and you say, oh, we want a suite, and you get a not so much sweet, you go with what you got. So post-editing will fix things up a little bit. Why this book? Why now?
A lot of it had to do with my own personal journey. Breast cancer on both sides of my family. So I had a grandmother I never met. On that same side of my family, I had a cousin who passed away at 51. She did have a major risk factor for breast cancer beside family history, and that was she never had children. On the other side, I had 2 aunts who had breast cancer. One passed away from breast cancer, and I have a cousin right now fighting the disease process as well. So a lot in my family. So 20% of breast cancer is inherited. The great news is 80% is environmental. So everybody does have a lot of control over many diseases that they could get. You can look at mitigating those risk factors.
Well, I think you said something right there real quick that I want to repeat. 80% is environmental. That means 80% there's an opportunity to have a heavy influence. So I speak today and then tomorrow, and tomorrow I ask a question. Is cancer a requirement or is it a choice? And with 80% of breast cancer being environmental, I think it leans towards the possibility that it could be a choice. Now, in some people, obviously, BRCA mutations and other issues, the environment still plays a role, but there's a strong predisposition. But we can still influence that. And you touched on that yesterday. I mean, you were talking about birth control pills. You were talking about things that people can do on a daily basis that puts really the power in their hands to influence their risk of breast cancer at a time where we're seeing the demographics of breast cancer change.
It does. It's now 1 in 8 women get breast cancer. There's a study to come out next year to say 1 in 7. Also, breast cancer used to be a disease that the prevalence or the incidence got worse with age. We're now seeing a lot of younger women, 25 years of age, that now have breast cancer. So we're starting to look more at environmental factors and what risk factors we can mitigate or fix. So for example, I have a gene that I inherited where I'm a poor methylator. For those of you who are wondering what that is, it's a CH3 group chemically that needs to be put on different reactions in the body. And about half of people inherit a gene where that reaction does not occur very well. The other people have a normal methylation. If you have poor methylation, you have an increased risk in breast cancer, for men, prostate cancer, heart disease, stroke, bone loss, and cognitive decline. The great news is you can test for it. Everybody can have a test for it, and we can fix it in 100% of people. So I've been personally taking a specialized B vitamin to help that pathway work better for 37 years.
Yeah, that's what you do so well, is you present the problem and you present the science, and then you provide the solution in a very sequential process and very quickly. And you did that very eloquently. Thank you. And I think that's I haven't had a chance to read through all the book, but I was going through it with great detail yesterday evening. But it seems like what you've created here is a kind of DIY, if you will. I hate to use that, but I think our listeners and our viewers understand that. A DIY of how to empower themselves to mitigate their risk. Is that really kind of what you were doing here?
Absolutely. And in doing that, it's really helpful. There's so many things that are so fixable. For example, one that's not a popular subject, but very important to know about is how much alcohol you consume. Women do not realize that alcohol in the body is broken down slower in women than men, and that alcohol increases estrogen in women. And so when you go to the second drink in a day, it does increase the risk of breast cancer 3 to 8-fold. So 3 to 8 times, which is significant.
Yeah.
So we can just have people cut back a little bit. The American Cancer Society does recommend that if you are like me, breast cancer on both sides of the family, that you should not drink alcohol. So I don't. It's just such an easy factor that I can change.
And let me tell you what, she practices what she preaches. What did you say from the stage yesterday? You said that somebody invited you for dinner and you said no, and explain to the audience why you said no.
I said no because I'm sitting here in Arizona and I live on the Eastern time zone. And so I try not to change time zones. It changes the circadian rhythm in my body. So that increases your risk of many diseases, including cancer. So I always dine a little bit earlier. And I did razz everybody and say, if you invite me to dinner, I'm happy to accept for that I will have the sparkling water and not the glass of wine or other alcohol.
Well, Paul Savage and I opened up the breakfast spot this morning, and then you were very closely behind there. So what I want to do is connect now, because I want to connect the environment, because you're doing something very instrumental there. And I want to connect that to the body and hormones, and I want to connect that to cancer. Well, both of those connect with cancer. You know, coming out of the COVID pandemic, we're still sitting in a situation where a lot of people, here I'm talking about doctors, they're pointing fingers and affixing blame. Now, I think there's a time and a place for all that, but our job is to focus on patients. Tell our listeners what really kind of innovation you're instrumental in right now in changing the impact on the environment, on our bodies with the TDE.
When we look at toxins, and there's many toxins, there's plastics, there's microplastics, there's toxic metals like lead, mercury, there's what we call forever plastics and forever chemicals where they stay in the body forever. Until recently, we have not been able to get rid of those. Let's take one, BPA. Nice short name. We'll make it nice and simple. BPA is an endocrine disruptor for both men and women, meaning that it changes where it binds in the body. So for women, BPA binds to estrogen receptor sites and increases the risk of 18 different diseases, one of which, of course, is breast cancer. We quit measuring BPAs 5 years ago because we did not have a good way of getting rid of them. So it's kind of bad to measure something in a patient and say, hi, I can get rid of 5% with the sauna, but that's all that I can get rid of. So we quit measuring it. Now with TPE, which stands for Therapeutic Plasma Exchange, we have a new technique where in every patient, male or female, any adult, we can lower BPAs 90 to 100% in everyone. So we now have a great way to get rid of these endocrine disruptors, but also the microplastics and the other toxins like forever chemicals and looking at toxic metals. It really does rid the body of almost every toxin there is.
I was at a conference last week, and it was with regenerative farmers. It was really interesting. It was policymakers, farmers, doctors, and advocates coming together. And I was super excited about it. But what I said is, what we've been doing is we've been farming with a pH, disease and pharmaceutical dependency, instead of farming with an F, health and wellness. And we need to go back to the original farming with an F, health and wellness. But that's what the toxicity of our environment is, because we've been farming with a pH, and we're getting what we've been farming, which is a byproduct of toxicity in our environment. But people think environment, they think outside the body. But what we're talking about is the outside impacts our inside, because we're a part of this ecosystem. And so if the environment's toxic, we're toxic. And I think that's why we're seeing some of the changing demographics in cancer. I think that's why we're seeing obesity, which you talked about on stage yesterday. I think that's why we're seeing alteration in the gut microbiome. And I think that's why we're seeing more aggressive and harder to treat cancers, and honestly, disease across the board.
Absolutely, and people don't realize that those simple changes that you can make. So let me give you an example. The hormone insulin, which is the hormone that regulates your blood sugar, it's so important for it to be perfect. It's the most important hormone the body makes when it comes to your risk factors for developing any kind of cancer, not just breast cancer. So you want that hormone to be a very perfect 6. So you can have your healthcare provider measure it. So it can be done at any lab fasting, and you want it again to be 6. In all my years of practice, which has been 48 years, I've only had one patient who had a normal fasting insulin at the time of diagnosis of their cancer. And again, that's any cancer. So you can regulate insulin by eating better. Yeah. You can regulate insulin by having better melatonin and sleeping better. You can regulate it with exercise. Oh, yeah. You can regulate it by not putting high fructose corn syrup into your body, and if you're going to eat sugar, have a better form. Yep. And you can even regulate it by the times that you eat. And that's the reason why I was saying that I really don't change my eating times, because you do make insulin at about 10 in the morning. So breakfast is the most important meal. Your mother really was right. If you eat breakfast, you are very, very healthy. And you also make insulin about 5 to 6 p.m. If you don't eat breakfast or you eat too late at night, then you teach insulin not to work effectively in your body, which increases the risk of all cancers, increases your risk of developing diabetes, heart disease, stroke, and to me, another really biggie beside cancer, memory loss. Oh, yeah. Memory loss is such a huge issue for people, and we want to be able to look at what they can do themselves to not go down that road.
You know, one of the things that, I've got a new book coming out with Dr. Jason Williams, where we talk about the interconnection between the hallmarks of aging and the hallmarks of cancer, really describing how the literature, we feel, really describes that they're one and the same. So we can treat cancer and we can target healthy aging at the same time. And there's animal studies that actually even suggest you can reverse it. And David Sinclair's doing great work there. But people go, well, okay, you talk about healthy eating, you talk about environment, you talk about lifestyle. Dr. Goodyear's talk about obesity. How in the world does that connect to hormones outside of BPA and the endocrine disruptor? Because all these toxins are affecting metabolism, and it's contributing to obesity. And people think that obesity here, we're primarily talking about white fat, they think it's inert, but it's very metabolically active. In fact, makes lots of hormones and inflammation. So touch on that and let's kind of dive into that, because then I want to dive into hormones, and I want you to be able to provide some points to the listeners and viewers about what they can do through lifestyle, first of all, other than buy your book, what they can do to help themselves with hormones, but connect that obesity to a metabolically active disruptor that just ripples through the body.
Well, it's such a good question, so thank you for asking, because it really is all about inflammation. A little bit of inflammation heals when you fall down, sprain your ankle, but too much causes disease. In fact, after the age of 42, almost every disease, cancer included, memory loss, heart disease, they're all inflammatory in nature. So we want to decrease inflammation. When you are a little bit overweight, it's not a big deal if you're 5 pounds, 10 pounds, okay. But when you start being 40 pounds overweight, etc., then literally, by definition, your body is inflamed. It also stores estrogen in the body. And so estrogen will go up. That doesn't mean estrogen's bad.
Right.
So let's start with women and then men.
Yeah,
if that
please.
Works.
Oh, yes, because
Okay.
I think that's a good distinction. Yeah.
It does, because with women, estrogen does have 400 functions in the body. So it's taste, touch, smell, hearing, skin tone. It lowers cholesterol, blood sugar, blood pressure. It is your memory, and it keeps your immune system intact. People don't realize as they age that their immune system becomes compromised. Big medical term for that called immunosenescence. And you don't have to have your immune system aging. And part of keeping it intact is to make sure your hormones are balanced. So women, if they haven't had breast cancer, we do keep them on bioidentical hormones. So estrogen is part of that, but we only give it to people when they're deficient. And that's really important, because if you're overweight, you may still have estrogen stored in your body and you don't need it because it's in that storage depot. In fact, my best friend passed away at the age of 72, never needing estrogen because she weighed over 100 pounds that she should have not. And so it's about giving the hormones that you need. For men, they do need estrogen. Believe it or not, men make estrogen. It's really important for memory. It's really important for bone structure because they can get osteoporosis or bone loss. Too much estrogen in men increases their risk of heart disease and prostate cancer. So we do measure estrogen in men just like we do with women. The big thing is we measure by saliva.
Yeah, I agree.
Saliva testing is really, really important as opposed to blood testing because it gives us better and more information.
And just got to give a little shout out to Dr. David Zava. She introduced me to him at one of the conferences, and of course, you've been long friends with David Zava, and of course, he was instrumental. In fact, the very first book I read in functional medicine was his "What Your Doctor Didn't Tell You About Breast Cancer," co-authored with John Lee. And I remember reading that in an airport, coming back from that first conference where I heard you. That was more schooling than it was a conference. But I remember reading that, and that changed me. Of course, Dr. David Zava started ZRT, which is now morphed into urinary testing, neurotransmitter testing. In fact, when I was diagnosed with a pheochromocytoma, the first reason I knew that I had it was because he called me, because I did their neurotransmitter test. And he called me, he said, "Nathan, you okay?" I said, "Well, yeah, David, good to hear from you. What's going on?" He said, "Do you have a pheochromocytoma?" I said, "I think I may." He said, "No, you do." So I didn't have a CT done at that time, but my my catecholamines were through the roof. But I knew that. But ZRT, great lab. There's other good labs out there, but David, I think, has done so much research on breast cancer, it's ridiculous. Pioneer.
Yeah, absolutely a pioneer in the field.
Just like she is. Did you know that 77% of the people watching my videos, Dr. Nathan Goodyear, don't subscribe? By subscribing to this podcast, you get access to real-time, cutting-edge integrative oncology, next-generation cancer care, the future to today. So we need your help. If this information is valuable to you, I encourage you to subscribe, because what that's going to give you is access to me, access to my ideas, my thoughts that are going to empower you to elevate not only your cancer care, but also your health and wellness. Also, that'll help us to build this community of hope and healing together. October is Breast Cancer Awareness Month. Most people don't realize it's hepatocellular carcinoma. It is primary liver tumor month. And I was doing some reading last night about hormones and liver cancer. It seems that estrogen receptor, it's still very, very preliminary. They are expressed in hepatocellular carcinoma. We're doing some research on hepatocellular carcinoma. That's why it caught my eye. But it seems that it was protective in the liver, ER alpha, versus in breast, when a lady or a man, for that matter, has ER positive breast cancer. What does that mean? That's a receptor, right? But it's a particular type of receptor. What does that mean as it relates to their treatment?
Well, there's really three different kinds of estrogen receptors. We know the most about alpha and beta. Alpha is the one that stimulates cell growth, so increases the risk of breast cancer. Beta is the one that decreases cell growth, so decreases it. And different things cause different hormones to bind to the different receptors, and some to bind to the less desirous ones. The science is now here that we can look more at that. Even herbs like Siberian rhubarb will help bind more to the beta receptor, the preferential one. But when it comes to looking at estrogen and the rest of the body, the 400 functions that we have been talking about of estrogen for women, there's estrogen receptors in the eyes. So estrogen helps prevent glaucoma, macular degeneration, cataracts. There's estrogen receptors on the heart, so it helps prevent heart disease 40 to 50% in 10 different ways. From lowering homocysteine to blood pressure to lowering lipoprotein A and making cholesterol work more effectively in the body and helping it to be less inflamed. There's also estrogen receptors on the colon, so it helps prevent colon cancer in women. And as you pointed out, there's estrogen receptors on the liver. So it's not just the obvious locations people normally think of.
You see why I had to have her on here? She is interconnecting things all over the body. When she lectures, she does the same thing. So she just has all the science there when she does it. So when you're sitting there in the lecture room and you're listening, you're just going, I'm drowning. But when it comes to estrogens, you're right, estradiol, estrone, estriol, and then the receptors. But the story doesn't end with estrogens. There's this process of estrogen metabolism. And again, David was one of the pioneers in being able to bring that to clinical practice. Touch just a little bit on estrogen metabolism and how that impacts risk as well.
That's, again, a really great question, because estrogen and those hormones are best measured by saliva, but the breakdown products, which is what metabolism is best measured by looking at urine. And if you look at just estrogen itself, and this is true for women and breast and men for prostate cancer, estrogen breaks down into, very simply, the 2, 4, and 16 hydroxyestrogens. The 2 is the good, you want mostly 2. 16 you need a little bit of to help the body work, bone structure, etc. Too much 16 does increase the risk of cancer for both men and women. The 4 is the bad one. It's just that simple. If you have 4-hydroxyestrogen, you have an increased risk in breast, for men, prostate cancer. Probably no surprise to anybody listening to this podcast that, of course, I broke down almost exclusively into 4-hydroxyestrogen because of my poor metabolization of looking at methyl groups.
Yeah, and so when you think about estrogen receptor positive breast cancer, if somebody's dealing with that, and I've seen 4 men with breast cancer, and I remember when I first got into the integrative oncology space, I was told that you may see 1 male with breast cancer, and I've seen 4. And by one of them, he was NASA and had primary breast and pancreatic.
Wow.
So really interesting times that we live in when it comes to cancer. Remember that they get broken down, and those metabolites, good, not so good, bad, those equally can have an impact, and particularly that 4-hydroxyestrone, that particular estrone metabolite, it can actually be almost more carcinogenic than the parent compound.
Oh, absolutely.
Because of how it binds, and it doesn't let go, and it just stimulates and stimulates and stimulates. And you mentioned correctly that it stimulates proliferation, and so if it unequivocally binds to it and it won't let go, it just stimulates ongoing proliferation to never stop.
And the great news is we can fix that estrogen breakdown if it's incorrect or not as desirous in every single patient. Okay. So it is entirely fixable. So
they can find that in the book, right?
It is. Again, its metabolization is the first morning urine test, so easy to do. It's inexpensive, and if you break down into the wrong estrogens, then we can have many ways to make sure you metabolize or break down correctly.
So just like we can influence our interaction with the environment and its impact on us, we can influence our own metabolism through, for example, estrogen metabolism. So we can steer towards healthier estrogen metabolism versus unhealthy estrogen metabolism, steering away from that 4-hydroxyestrone.
Well, that's why it's so important that we look at all this. And that's what I love about what you call integrative, I'll call personalized medicine, because it is personalized. We look at the cause of the problem and not just treat symptoms.
Yeah.
And that's really the big change in medicine, is looking at the cause.
Yeah, the root causes, remember, plural root causes. There's never just one. So I want to touch real quick on this. We were talking about it right before breakfast. Progesterone. A lot of people focus on estrogen. They fail to recognize progesterone. 2 parts here. First of all, explain the difference between progesterone and progestins, number 1. Number 2, progesterone metabolites. I asked you if you're familiar with Weeby's work as it relates to progesterone metabolites, and I want to get into that because it shows you how sometimes science is yet determined and how that impacts clinical insight. But first, describe progesterone versus progestin.
Well, a lot of scientists, believe it or not, do not know the difference.
I know.
It's fascinating because progesterone is the natural form, meaning the same chemical structure that God gave you when you were born. Natural in medicine does not mean it comes from a plant. In this case, it is made from either yams or soy, more commonly yams, but really natural means the same chemical structure that you're born with. So that would be progesterone. If you don't have enough progesterone, then you can have anxiety, irritability, insomnia, mood swings, depression, heart racing, bladder problems, gut disturbances, and an increased risk in breast cancer, uterine, and ovarian cancer. So there's a lot of reasons that progesterone is there, it really does balance estrogen. And that's how God made us, is there's a balance to everything in the body. It's
right.
perfectly balanced. And sometimes some practitioners, if a woman has had a total hysterectomy, they give her estrogen, but they don't give her progesterone. The studies show that progesterone should be given not just for symptoms, but women without progesterone who've had a total hysterectomy have an increased risk in getting cancer of the ovaries.
Now, that's an important statement that she mentioned there, because you got to understand the source of this information. First of all, she presented all the science to support this. Of course, there's much more. But I would actually label Dr. Pam Smith as the premier authority as it relates to hormones in women and men that really is there today. So when you're making those statements, know, the listeners and viewers, that these are statements founded in science, repetitive in the science, and it's coming from what I think is one of the global experts on hormones and health and chronic disease, inflammation, as you mentioned. So we talked a little bit about progesterone metabolites, just as there are estrogen metabolites. There was an author and his team that, and I like this because it shows how people think science is always settled. Oh yeah, de facto, we know, we're done, move on. Weeby's team said, well, there's progesterone metabolites. So you can go down one pathway, you can go down other. One may be more protective, one may be more carcinogenic. But as we were talking, nobody else has replicated that work. And so, though that's interesting, right now we can't say definitively that is the case, because I don't like it when I read articles and say more science is still needed, more research is still needed. But in this case, that is true.
Yes, because it's preliminary work. And we want another study or 2 or 3 or 4 to confirm that. It's just like the synthetic progesterone called progestin. 40 years ago, David Zava, John Lee, and others talked about synthetic progesterone, meaning not the same chemical structure, progestins. And progestins, the studies now are confirming, because there's many, that yes, you can have symptoms, you can get anxiety, you can get other symptoms. It doesn't balance estrogen when progesterone is synthetic. Again, that's the progestin. In fact, it doesn't balance estrogen, so it doesn't prevent breast cancer and heart disease. But now the studies have confirmed, numerous of them, that progestin is linked to an increase in developing breast cancer. And then now looking at the breakdown products, again, more to come on that subject, we're going to have even more information.
Yeah, and I don't think it's going to be pretty information. So I want to wrap up with 2 different hormones, though they're interconnected. Well, all hormones are connected. It's just a hormone of milieu. But stress, cortisol, and sleep, melatonin. People go, well, how are they connected? Well, they have a chronicity, a circadian rhythm that are balancing each other. We said everything's created in balance, right? 2 arms, 2 legs, 2 eyes. Estrogen, progesterone. Could you not put cortisol and melatonin there a little bit as well?
You could, and you would start first of all with cortisol and DHEA, which is the initial balancing hormone. People don't realize cortisol is your hormone of stress, but you have to have it. If you don't have cortisol, you die in 1 week. So the body will preferentially make that hormone over all the other hormones in that pathway that makes hormones. So you have to have cortisol. When you're first stressed, cortisol elevates. When you've been stressed for a long time, the body still makes cortisol, it just doesn't make enough. And that will negatively impact how its companion hormone DHEA works. And DHEA makes estrogen and testosterone in both men and women, because you're right, it is a hormonal symphony.
Oh, it is.
That occurs. But also it does affect melatonin. Melatonin everybody has heard about. And we do measure that with saliva testing. And melatonin is such an important hormone for sleep, but also it's what we call an immune modulator. So it helps regulate how the immune system works in the body. So hugely important hormone.
Yeah, and one of the things that I've talked quite recently about, and I'll be talking about tomorrow, I think, just to show how the reality of repurposed medications can be helpful in a real-time setting, is post-operatively, where you get acute elevations in cortisol, epinephrine, etc. And what that stress response does is it suppresses natural killer cells, T cells. It actually increases immunosuppressive cells. It just compromises the immunity within the local environment and systemically, and that in turn plays a negative impact on local recurrence. And so stress has real implications, where this study was actually published in 2020. They gave celecoxib, a COX-2 inhibitor, and they added it with propranolol. And they took it before and then right after surgery. And they were able to significantly blunt that impact with those two repurposed medications. Now, she's talking about hormones, and she's the master of hormonal therapy to balance it. But what we're talking about is stress, not something that's some theoretical thing in the sky where you had a rough day or you were caught in traffic. Here in Scottsdale, Arizona, people drive like nuts. At least we have 6 lanes. In Florida, you kind of have 3 or 4. But the stress response has significant immune impacts. And when we're talking about cancer, there's already enough challenges with the process of cancer when it's there. The less unforced errors we can introduce to that, the better. And so where we can balance the immune system, where we can support the immune system, reduce untoward stress, we can actually have an impact on that patient's health through their immune system. And cortisol sits front and center in that process.
It really does. And honestly, at this age, I'm 71, I don't stress about a lot. I pretty much let go and let God and let Him take care of it, or her. And I don't really worry about a lot except for one thing, and that's when my technology does not work. If I have trouble with my computer or my cell phone or something else, then I have to admit I do get a little stressed.
That's funny.
What people don't know, though, is that everybody makes cancer cells. Probably 6 or 7 times in your life. And there's 3 things that feed cancer cells that we know of today. 1, cortisol, stress. It literally feeds cancer cells and makes them grow. 2 is sugar. That's the one I personally have trouble with. I happen to love chocolate, so I have to keep that to where it should be.
Fair enough.
And then the third one is toxins. Toxins feed cancer as well. So getting a handle on those 3 things really does decrease the risk of developing all cancers. And if I had to just choose one hormone that impacts every disease, it would be cortisol. You're entirely right. It impacts everything we do.
And there's a rhythm to it.
There is.
It's highest in the morning. You mentioned there's a 4-point cortisol we look at through saliva testing. And then you can look at the metabolites. So you can really kind of see how the body's steering and being steered. And so it gives you much more of a functional, individualized assessment of what their hormone's doing. But if your cortisol's high, that has a negative impact. If your cortisol's low, that equally can have a negative impact. So it's not just that it's whether it's high or low, it's either or can be detrimental in context to the impact it provides on the immune system. And that's really what it's about, because it's about how your hormones are modulating your immune system. And honestly, you touched on this yesterday, inflammation modulates the hormones.
It does.
It's a bi-directional process.
Well, that's how we know that evolution, if you want to talk about evolution, was really designed by God. Because if you had all these different things out in the world that weren't connected, then you might believe in just evolution by itself.
Right.
But really, God designed it all. That's the reason why there's a connection between all these different things that occur. And stress does have that overwhelming influence what happens to everybody. But you can mitigate that too. Stress reduction techniques, prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, acupuncture. You can take adaptogenic herbs, you can take calming herbs. When you measure that cortisol, if it's high in the morning, it means you did not get restorative sleep. So insulin can go up and bad things can happen. For a woman, if she, for a long time, not just one time, but for a long time has high cortisol at night, we now know that increases her risk of developing breast cancer. So we want to work with her in getting that cortisol down with the stress reduction techniques. But there's also a nutrient that's interesting. It's called phosphatidylserine.
Oh yeah, I love that.
And phosphatidylserine we use for memory, because it increases acetylcholine, the main neurotransmitter of memory, but we've also discovered if you take 300 milligrams a day of phosphatidylserine, it lowers that cortisol that occurs at night to decrease the risk of developing breast cancer.
Great for the brain. Great for the brain. So let's wrap up on melatonin. Somebody with breast cancer, female or male, what's the impact of melatonin? Because most people look at melatonin, they go, oh, I need to take this to sleep better. But tell them, maybe just a couple things of how melatonin can help them in the journey with cancer.
Because it is an immune modulator, there are great studies when it comes to melatonin and breast cancer. So there's a clinical trial and now a follow-up trial showing that if the person has stage 4 breast cancer, 20 milligrams of melatonin is actually being used as a treatment, as an adjunct therapy to chemo and other kinds of treatment for breast cancer. And I've kind of extrapolated that personally. So if my patient has stage 3, I give them 12 milligrams of melatonin. If they have stage 2, 6 milligrams, and stage 1, 3 milligrams. It is important to measure because melatonin, if you get too much, it lowers serotonin, your happy neurotransmitter. But the interesting fact is with breast cancer and other diseases, we find that melatonin is so important that it doesn't rise if it's being used to help the immune system work. And we found that out particularly with COVID, because large doses of melatonin were used for people with long-haul COVID, for people when they had acute COVID or sudden COVID attacks, up to 50 milligrams of melatonin. So big dose.
Yeah, I dose it a little bit higher because I'm trying to modulate very particular immune pathways that are very critical in the tumor microenvironment. We don't have studies on how to dose that, but you advised me about 50 milligrams to try to modulate what's called endolamine 2,3 dioxygenase pathway, which is very key in how it's actually in the serotonin pathway, but what it does is it creates immunosuppression. And within the tumor microenvironment, cancer upregulates that process to suppress the immune system. So I hope that in the future we'll have some research that will guide us there. But what I always say too is maybe I need to be the one doing the research. Maybe we need to be the ones doing the research because it's not enough to know it. It's not enough to talk it. It's not enough to apply it to patients. We need to also produce it.
And that's the great time about being alive right now. The science is really here to help people be healthier. We can do all these studies and look at the cause of the problem. It's just a fabulous time to be alive, to be a patient, to be a practitioner. We can help people in so many ways.
Now, you are still active in the teaching role. I mean, you are co-director, and so doctors can learn underneath you right now. So if a patient's out there and they want their doctor to find you to learn more about you, or if a doctor is watching and they want to find out more information about you and train underneath you, underneath that didactic setting, how would they find that?
They can just go to personalizedmedicinecertification.com. So personalizedmedicinecertification.com, and it will pull up the entire training program. We do hope all practitioners decide to become trained in an integrative personalized medicine approach because it is the wave of the future. Having said that, if I was just going to choose one thing that was going to change medicine for the next 10 to 20 years, it would be TPE or therapeutic plasma exchange. I do not say that lightly because of my age. I have been around for a long time. So yes, CAT scan also, it came out when I was in medical school. Ultrasound came out when I was an intern, so they brought the little earphones to grand rounds when you're an intern, and they gave us little earphones and they said, this is an ultrasound machine. It will revolutionize medicine for everybody. Later on, when I was a practicing doctor, then came MRI, PET scan, etc. But the things that are going to change medicine are things that decrease inflammation. And certainly getting rid of toxins with therapeutic plasma exchange will lead the way for the next 10, 15 years.
And you can find every bit of information you want to know about TPE, about how to find Dr. Pamela Smith in terms of training, her books, or just whatever. You'll be able to find that in the show notes. Remember, innovate, elevate, empower. We empower with knowledge, wisdom, science, and where the science is, we follow it because the science leads the way in individualized medicine, precision medicine, integrative medicine, whatever we want to call it. And where we can find the experts of that science to talk the science, like Dr. Pamela Smith, we bring them in. Precision medicine, it's the right treatment for the right patient in the right combination at the right time. That's individualized medicine, providing therapy to heal the body. And when we're dealing with cancer, it's healing and targeting the tumor simultaneously. It's time we declared peace, not war, in the fight against cancer, and that we target the tumor for elimination, but heal the body through empowerment of the immune system. Of course, check out the Cancer Vault, which you'll find in the show notes as well, where I do my own rabbit hole deep dives on the science, and you can as well right there in that Cancer Vault. Now, we need your help. Sadly, we are still dealing with censorship, suppression, shadow banning. So watch this podcast. You like it? We encourage you to please subscribe and share it to those that can benefit. And trust me, every patient out there can benefit from what the expert, Dr. Pamela Smith, just said. And you can then buy them book, because I believe we have a holiday upcoming where this would be a great stocking stuffer or right underneath the Christmas tree. And by the way, just throwing that in there, I'm not getting paid for this, but it would be a great gift, I think, for anybody out there, because we're seeing more and more cancer, and it's time that we empower patients to heal themselves. Dr. Pamela Smith, thank you for joining me. Thank you for leading the way that so many of us have followed, and you continue to lead the way.
Thank you very much.
I'm Dr. Nathan Goodyear, and I'll see you on the next Prescribed by Dr. Nathan Goodyear podcast.
Thanks for joining us on this episode of the Prescribed Podcast. All references supporting this episode can be found on the prescribed.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribed. We'll see you for your next refill.